Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for hiccup. What are causes, that is precipitating factors of hiccup? Taking a huge meal, drinking a carbonated beverage or alcohol, getting excited suddenly, eating, drinking too fast, facing sudden variation in temperature, underlying medical conditions like sore throat, GERD, that is gastroesophageal reflux disease, tumor in thyroid, sore throat, again sore throat or laryngitis, sore throat twice has come, no matter, gulping air while chewing gum, smoking, inhaling toxic fume, nerve irritation or damage to central nervous system. What are symptoms of hiccup? Uncontrolled spasm of diaphragm, hic sounds, tightened feeling of throat, chest, abdomen, uneasiness. When to consult a doctor in hiccup? If hiccup lasts longer than 2 days, then one has to consult doctors. If it creates problems like that of breathing, eating or sleeping, also he is to consult a doctor. Here, this particular muscles is called diaphragm. This muscle separates chest from abdomen. It is lung, that is chest. Below this muscle diaphragm lies stomach. Here, these are the two vocal cords. This vocal cord abruptly closed with a hic sound. That is this abruptly closed with a hic sound. This happens in this particular disease called hiccup. What can one do to keep off hiccup? That is prevention. It is very difficult to prevent hiccup fully. However, avoiding things that precipitate hiccup, just described in the early slide, one can prevent hiccup to a long extent if that points can be just opposite, doing opposite of that particular precipitating factors. Can hiccup be a sign of some fatal disease? Fatal disease means disease that cause death. Generally not, but very occasionally it can be a sign of some serious problems lurking behind, like a disorder of central nervous system, brain tumor. Generally it is just an annoying thing to put up with. Generally annoying thing. Sometimes it becomes a trouble, a serious trouble, but never fatal disease. This is never. Naxbomb for hiccup. Acute problem. Hiccup from overeating, from cold or hot drinks, adapted to debauches. Debauches means who perform sexual activity overtly. Persons drugged heavily and leading high lives. Patients are oversensitive to all external impression like light, sound, noise, touch, pain. That is, they cannot tolerate any of these things. Not either light, not heavy sound, not too much noise. This type. Ignatia for hiccup. Hiccups after drinks, eating, smoking. Hiccups with eructation, nausea and vomiting better, taking indigestible thing. Note this symptom. Nausea and vomiting better, taking indigestible thing. USP, uncommon, strange, peculiar symptom. If you can get this symptom, you can directly give ignatia. Consolation words from problems. Consolation words their problem. That is, if you give him consolation, some supporting words, he will be much more aggravated condition. So in ignatia, in netramuria, there are so many patients, they cannot tolerate consolation from other persons. They usually suffer from involuntary sighing. Their mood change very often. Ignatia patient is really particularly most effective for lady patients. Cyclamen for hiccup, used after Nux has failed. Hiccup with eructation or yawning. Hiccup with pregnancy. They suffer from ill effects of grief and terror of conscience. Terror of conscience. They're very conscientious patient. So they always suffer from this. Have I done something wrong? Am I wrong? Have I done something wrong? Is this type of conscience always torment them. Nectar mule for hiccup. Constitution wrecked with malaria. Irresistible hiccups. Tobacco smokers hiccup. Hiccup with burning eructation. Most trouble worse from sunrise to sunset, especially from 10 a.m. to 11 a.m. but relieved by perspiration. This is characteristic of natramure patient. In all natramure patient, in all diseases of natramure patient, this symptom will be there. Consolation increases complaints. They have lacrimal disposition and hypochondriacal mood. Hiccough for hiccup. Continuous spasmodic hiccup. Deathly nausea. Regurgitation of food long after eating. They are mostly thirstless patient. Suffer from herpetic eruption on end of nose. Carbohydrate for hiccup. Aversion to most digestible things and the best kind of food. Loathe even the thought of foods. Digestion very slow. Food turns to gas. Hiccup from slight movement. They feel very much relieved when fanned on their face from a short distance. This is a characteristic feature of the patient himself. Carbohydrate. This symptom is always present in every problem. If the patient is really of carbohydrate type, they feel relieved when fanned on their face from a short distance. Lycopodium for hiccup. When asked to show tongue, patient's tongue once comes out, then again it contracts and go inside the mouth. That is, the patient cannot keep his or her tongue outside. Though doctor wants that. Trouble felt more from 4 p.m. to 8 p.m. They crave sweets, pastries, warm food and drinks. These also patient's characteristics. Lycopodium patient characteristic present in every symptoms and with every other diseases where the patient is of lycopodium nature. Most cause for hiccup. Hiccup of hysteria patient, aversion to food, nausea on seeing or thought of food, often busy in soliloquy. Soliloquy means self-talking, talking to himself or herself. Suffer from violent fits of anger, leading to easy fainting. This go into unconscious state. Cicuta virosa for hiccup, loud hiccup with crying. Patients unable to distinguish between edible things and non-edible things. After epileptic attack, do not remember what has happened, do not recognize anybody, but answer well. Ginseng for hiccup can be given to all types of hiccup. Generally, mother tincture 15 drop given every 10 minutes for instant action. On the right hand side, an instruction has been given. Hiccup is mostly acute or seldom may be chronic depending on the history of the cases. In acute cases, use mother tincture to 30 potency in short interval. In chronic cases, use potency 200 onwards with suitable interval.